Hello, everyone. My name is Dr. Mark Allen, and I'm one of the co-founders of Cognitive FX. And I'm going to be reading one of our blog posts called Post-Concussion Syndrome, Persistent Symptoms, Diagnosis, and Treatment. Post-concussion syndrome, also known as persistent post-concussion symptoms, PPCS, occurs when concussion symptoms persist for months or years after you sustain a mild traumatic brain injury, or mTBI, or another type of brain trauma. If you or a loved one received a post-concussion syndrome PCS diagnosis, you're probably wondering if it's treatable. Short answer, yes. You may also want to know how long recovery takes, what you can do to alleviate symptoms, and whether what you're expecting is normal. We treat hundreds of post-concussion patients every year and regularly answer these questions for our patients. This guide will help you understand post-concussion syndrome in depth by answering a number of questions, including what is post-concussion syndrome? What causes post-concussion syndrome? Is post-concussion syndrome permanent? What are the symptoms of post-concussion syndrome? Can you have post-concussion syndrome years later? How can you get a post-concussion syndrome diagnosis? What are the options for post-concussion syndrome treatment? What if your post-concussion symptoms persist after treatment? How long does post-concussion syndrome recovery take? We also share stories from 4 patients who made successful post-concussion syndrome recoveries. If you've experienced one or more concussions and your symptoms persist, you're not alone and you're not imagining it. Help is available. Peer-reviewed research shows that 77% of patients treated at Cognitive FX experience significant improvement in their post-concussion symptoms. Cognitive FX is the only post-concussion treatment clinic with third-party validated outcomes. To see if you are eligible for treatment, schedule a consultation. What is post-concussion syndrome? Post-concussion syndrome occurs when a patient experiences persistent symptoms 3 months or more after a head injury. Those symptoms could include headaches, brain fog, fatigue, sleep problems, memory issues, vision problems, and more. PCS can develop after a concussive event, falls, car accidents, contact sports, etc., or another close head injury. It doesn't take a direct hit or loss of consciousness to constitute a concussion. Many patients suffer concussion symptoms after whiplash or jostling their brains. What causes post-concussion syndrome? Post-concussion syndrome can develop after a mild, moderate, or severe TBI. It can also come from brain traumas like carbon monoxide poisoning, transient ischemic attack, TIA, chemical exposures, certain viral or bacterial illnesses, surgery, and more. Post-concussion symptoms stem primarily from dysfunctional neurovascular coupling, or NVC, which is a dynamic relationship between neurons and the blood vessels that supply them. When you experience a concussion, or TBI, your immune system causes inflammation near the sites of injury. The affected parts of your brain experience a temporary breakdown of tiny structures in and around those cells. As a consequence, those cells don't get the right amount of oxygen at the right time to power the signaling your brain normally does. When you try to do something that those cells govern, like encoding a new memory or paying attention to a conversation, they won't be able to accomplish the task. Other neural pathways will then attempt to complete the process, even though it's a less efficient path for that information to take. The result of NVC dysfunction is these hypoactive brain regions that can't do their fair share of the work. Other brain regions will try to take on more work than they should, but they can't do so efficiently. This tires your brain out, leading to post-traumatic headaches, feeling overwhelmed, irritability, and other symptoms. For the majority of people who suffer from a concussion, symptoms usually resolve 3 to 6 weeks post-head trauma. We assume that's because the brain goes back to using the best pathways for any given process, although it may be just really good at compensating for the injury. But for post-concussion syndrome patients, the brain keeps using less efficient pathways to complete tasks even after the inflammation is resolved. That suboptimal signaling is what results in long-lasting concussion symptoms. If suboptimal signaling seems confusing to you, think of it like a road traffic. A healthy brain would distribute traffic, i.e. the signaling and blood flow dynamics needed for a task like reading, equally along existing pathways. The suboptimal signaling is like getting stuck in a traffic jam or taking a frontage road instead of the highway. It's inefficient and requires more gas to get to the same destination. The more your brain has to use suboptimal pathways, the more likely you are to experience symptoms. A concussion may also result in autonomic nervous system dysfunction or dysautonomia, hormone dysfunction, vision problems, vestibular dysfunction. These post-concussion complications can produce many of the long-lasting symptoms characteristic of post-concussion syndrome. Post-concussion symptoms can last for weeks, months, or even years after the concussive event. In general, if your symptoms have not gone away after 3 months, it's a good idea to explore treatment options. Is post-concussion syndrome permanent? Post-concussion syndrome can be permanent if you don't receive treatment, but it often resolves or improves with the right therapy. It can be more difficult to treat some people due to their underlying factors, including cervical spine problems that contribute to the symptoms of PCS they are experiencing. In one of our published research articles, we collected and analyzed data from 270 concussed patients. We were able to confirm the effectiveness of the FNCI-based and accelerated concussion treatment approach that we founded Cognitive FX on. It was this research that inspired the founders to develop the clinic into the fully functional treatment center that it is today. Patients who underwent 4 days of EPIC treatment demonstrated significant improvements in both objective and subjective data. On average, patients improved by 75% on the severity index score, which is the severity of the dysregulation of blood flow in the brain. Of the 270 concussed patients, 62% of the patients reported an improvement in their post-concussion symptoms after those 4 treatment days. Many of our patients continue to report decreased symptoms and increased quality of life over time. In our most recent research publication, we explain the FNCI, or functional neurocognitive imaging, a type of MRI that we use to see the dysfunctional brain regions of each patient. Using that information, we can develop a custom treatment program for our patients struggling with PCS. This research shows how the treatment program we offer can target and repair the dysregulation found in post-concussion syndrome thanks to neuroplasticity, our brain's natural ability to adapt and recover. Multiple concussions will not necessarily cause post-concussion syndrome, but they are a risk factor for developing PCS. We do not know why some individuals develop PCS symptoms and others do not, but we do know that you have a chance of developing PCS after each concussion. That said, a previous concussion is not a reliable indicator of whether you will develop post-concussion syndrome. Some other indicators are more reliable. For example, women and those with pre-existing depression have a higher risk of developing PCS regardless of concussion history. Up to 30% of all concussion patients develop lasting post-concussion symptoms and sequelae to some degree, a much higher incidence than you might expect given the current lack of awareness in the medical community. What are the symptoms of post-concussion syndrome? We compiled a list of the most common emotional, physical, and cognitive symptoms of post-concussion syndrome reported by patients. The emotional symptoms are anxiety, depression, feeling overwhelmed, impulsiveness, irritability, mood swings, PTSD, social anxiety, and teariness. Cognitive symptoms are brain fog, difficulty concentrating, difficulty finding things, difficulty reading, getting lost, long-term memory problems, short-term memory problems, slowness to decide, think, speak, or act. Physical symptoms, blood pressure changes, change in or loss of taste of smell, difficulty balancing, dizziness or vertigo, exaggerated startle response, exercise intolerance, fatigue, feeling anxious without anxious thoughts, GI issues, headache, heart rate issues, intolerance of caffeine or alcohol, light sensitivity, nausea, sexual dysfunction and low libido, shaking or shivering, sleep disruption, temperature irregularities, tension in the neck, jaw, and or shoulders, tinnitus, vision problems, double vision, blurry vision, tired eyes, etc. The symptoms from your initial injury may not be the same as the symptoms you experience over time. For example, you may find that initial confusion goes away, but exercise becomes increasingly difficult. Your specific symptoms may vary from the norm, or they may be quite similar to what other patients experience. The good news is that it's usually still treatable. As we work on patient education, we've developed resources to help patients understand specific post-concussion symptoms. Post-traumatic headaches. What causes headaches after a minor head injury, how they manifest, and how to treat them. Functional vision problems and light sensitivity. What you might experience, how it's treated, and how other patients with vision problems got the help they needed. Sleep with post-concussion syndrome. Read about what's disrupting your sleep, how it affects your prognosis, and what you can do about it. Post-concussion fatigue. What's making you so tired and how to get your energy back. Difficulty exercising post-concussion. How to exercise safely after concussion, even if you're feeling dizzy or getting headaches when you try to work out. Brain fog and PCS. What causes cognitive impairment after a brain injury? How to help your brain work better again. Post-concussion syndrome nausea. What causes this unpleasant symptom and what you can do to overcome it. Difficulty concentrating, impulsiveness, and attention deficit disorder. The relationship between brain injuries and ADD or ADD-like symptoms. Blood pressure changes and POTS. How concussion and dysautonomia can affect your blood pressure and how it's treated. Memory loss, short-term memory problems, and long-term memory problems. How memory loss has affected some of our patients and how it improved after treatment. Feeling hot, cold, or fevered. Why concussion can affect your body temperature and what symptoms to watch for, and how to handle them. Difficulty balancing, vertigo, and other vestibular symptoms. Why vestibular problems happen after concussion and how they're treated. Heart rate changes, palpitations, and more. Read about how concussions might affect your heart and what you can do about it. Gastrointestinal symptoms. Read about concussion-related symptoms like loss of appetite, stomach upset, food intolerance, acid reflux, and more. Intolerance of caffeine or alcohol. Why head injury could mean you're no longer able to enjoy caffeinated or alcoholic beverages. Post-concussion neck pain. Read what causes neck pain after a head injury and how it's treated. Post-concussion loss of smell or taste. How concussions affect the senses of taste and smell, altering them or even completely preventing them from functioning. There are fewer treatments for these post-concussion symptoms, but patients do have a few options for relief. Concussions lead to emotional symptoms too. Brain injuries can damage connections that go from the cerebral cortex, the part of the brain that has a role in memory, attention, perception, cognition, and awareness, to the limbic system, the part of the brain that supports functions such as emotions, behavior, and motivation. Changes in mental health are some of the most common symptoms of PCS. A brain injury is emotionally traumatic as well as cognitively debilitating. People can respond with frustration, anger, anxiety, and depression to their changed capabilities and life circumstances. Even a mild head injury can lead to mental disorders like post-traumatic stress disorder. Making matters worse, an injury affects how the brain interprets the information it receives and how it processes this information. This can make it difficult for someone to understand and express what they're feeling to others. Psychological factors can also increase the severity of other non-emotional symptoms like sleep problems and headaches. By the way, we created an online course that covers which type of headaches you can get after concussion, as well as specific techniques for coping with those types of headaches. If you want to learn how to manage your headaches at home, check out this course. We've written several guides for people struggling with mental health changes after injury, and these are post-concussion depression, post-concussion anxiety, post-concussion post-traumatic stress disorder, post-concussion personality changes, and mood swings. Often patients with emotional symptoms are given prescriptions for antidepressants, mood stabilizers, or other psychoactive drugs. A brain injury makes you more susceptible to negative side effects, so monitor your symptoms carefully. It is best to treat the brain injury with active therapy, something we'll discuss below, and resolve any persisting mental health issues at a psychiatric practice. Your doctor can determine whether additional pharmaceutical intervention is necessary. Can you have post-concussion syndrome symptoms years later? Post-concussion symptoms can persist or reoccur years after the original injury. In general, these symptoms tend to stay the same or get worse over time until they are properly treated. Some patients also develop new symptoms due to complications from their condition. In adults, as the brain ages, there is a natural decline in mental function. When you add a complication such as post-concussion syndrome onto this natural decline in function, the two causes. In adults, as the brain ages, there is a natural decline in mental function. When you add a complication such as post-concussion syndrome onto this natural decline in function, the two cause a decrease in mental capability. History of concussion is also linked to structural and functional alterations in aging individuals, even those that may present with normal neuropsychological performance. In addition, post-concussion symptoms often feed into each other. For example, if you have migraines and trouble sleeping, the two will make each other worse over time. The concussion headaches can make it harder to sleep. The sleep disturbances, like insomnia, waking up a lot at night, poor sleep quality, etc., make you more likely to have headaches. And with those, other symptoms such as brain fog, fatigue, ability to focus, and so forth can all get worse as well. Patients often find themselves in a slow downward spiral that they can't escape without help. Not only does it take a severe toll on their quality of life, but it can also worsen any existing psychiatric disorders or emotional symptoms they experience. This is why it is so important to get the right diagnosis and treatment, especially if your concussion symptoms are worsening. The good news is that we've detected no difference in recovery rates whether you've had a post-concussion syndrome for just over a year or over a decade. The brain is still capable of healing after all those years later. For further reading, see Former Figure Skater Finds Relief After 14 Years of Post-Concussion Syndrome, and Businessman Recovers from Persistent Symptoms 33 years after his injury. How do you get a post-concussion syndrome diagnosis? There's no one test available to prove you have post-concussion syndrome. Your doctor might want to order a scan of your brain to check for serious damage. A computerized tomographic scan or CT scan or magnetic resonance imaging MRI may be performed to detect structural brain abnormalities or damage to the bone. That said, these scans will not identify the presence of PCS. If you're experiencing dizziness, you could be referred to a medical professional who specializes in ear, nose, and throat complaints. Your doctor may recommend a psychologist or licensed counselor if your symptoms include anxiety or if you're having problems with memory. Fortunately, there are more tests for post-concussion syndrome than that. The FNCI we offer, various physical and neuropsychological testing, and symptom reporting can all be used in diagnosis. For further reading, see post-concussion syndrome tests. Can an MRI detect post-concussion syndrome? In most cases, an MRI cannot detect post-concussion syndrome. An MRI uses magnets to look at protons, positively charged particles, in water. In regards to a brain scan, that means the image is of the soft tissue in your head. An MRI doesn't show the skull bones well, but it will show the structure of your brain because that's where the water is. The protons in water respond to a magnetic field differently based on what kind of tissue they're in. By using MRI technology, we can look at those differences to determine what kind of tissue is being observed and the shape of that tissue. Because of this, a regular MRI is powerful at detecting serious issues in the brain such as strokes, aneurysm, tumors, bleeding, and so forth. Unlike structural damage caused by tumors or brain bleeds, mild traumatic brain injuries do not show up on standard brain imaging tests because the tissue is not damaged in an obvious way. Head trauma impacts the ability of neurons to signal for the right amount of blood to accomplish certain processes, but does not impact the structure of the cells themselves. To learn more about the difference between MRI scan and an FNCI scan, read our post called Can an MRI Detect Post-Concussion Syndrome? At this point, you may be wondering why FNCI is effective since it's a type of MRI. FNCI is a type of functional MRI rather than structural MRI. Functional MRI is designed specifically to show blood flow in an organ rather than structural integrity of that organ. So if you get a functional MRI of the brain, you can see which regions of the brain are calling for increases in blood flow, which is generally indicative of increased activity. By having patients complete the same set of tasks in the MRI machine, we can tell the difference between patients who have a healthy response to those tasks and those who don't, like post-concussion syndrome patients. That information not only helps us diagnose PCS, but also to tailor treatment to the specific needs of each patient. Evaluations for post-concussion syndrome at Cognitive FX. Typically, healthcare professionals will diagnose someone with post-concussion syndrome when their symptoms last longer than 3 months and other potential causes for the symptoms have been observed but ruled out as the cause of the patient's persisting symptoms. At Cognitive FX, we look at several indicators, including whether FNCI results for the patient are normal or abnormal, what symptoms the patient is experiencing, which they rate on a severity scale, how the patient performs on assessments of balance, vision, and hand-eye coordination, mental health as assessed by our clinical psychologist. With the second-generation FNCI, we're able to assess 56 regions of the brain for neurovascular coupling dysfunction as mapped to 27 functional descriptions. Note, while the FNCI is a key diagnostic tool. We also obtain a structural MRI of the brain and cervical spine for each patient. If we find any structural issues, we will refer you to a neurosurgery practice so you can get the help you need. We use all of the data we collect to inform personalized treatment plan that targets the specific physical and cognitive deficits you are suffering. Are you seeking a post-concussion syndrome diagnosis? We can help. Schedule a consultation to learn what steps you can take next. Post-concussion syndrome treatment. If you are diagnosed with post-concussion syndrome, what should you do next? The best treatment for post-concussion syndrome involves physical exercise and therapy from multiple disciplines. Some doctors try to manage PS symptoms with medication, but this approach has serious downsides. There are also some natural remedies that can help, although they can't fully treat the condition by themselves. We'll share some resources regarding each in this section, along with where to find doctors who treat post-concussion syndrome. Active rehabilitation of post-concussion syndrome. At our post-concussion treatment clinic, we use a combination of exercise and multidisciplinary therapy. Our patients benefit from a phenomenon called the post-exercise cognitive boost. In short, aerobic activity brings on an increase of essential neurotransmitters and proteins in your brain that help develop and promote blood flow. One example is brain-derived neurotrophic factor, or BDNF, which has been shown to increase post-exercise and help PCS patients in their recovery. Due to this increase, your brain is more able to perform complex cognitive challenges for longer periods of time. Eventually, the PECB, or post-exercise cognitive boost, provides a window of time after exercise in which cognitive abilities are sharpened. Exercising consistently over time also has long-term benefits for your cognitive function. At our clinic, we combine the PECB with a range of multidisciplinary therapies, including neuromuscular therapy, occupational therapy, cognitive therapy, neurointegration therapy, sensory motor therapy, vestibular therapy, dynavision, and more. Patients also have scheduled rest with brain waves and at least 2 sessions with a psychologist. To learn more about our approach to rehabilitation for post-concussion symptoms, you can also visit our EPIC page. EPIC stands for Enhanced Performance in Cognition Treatment. Medication for post-concussion syndrome. Medications often come with side effects and/or long-term consequences, especially for brain-injured patients. And unfortunately, many patients find that their medications are minimally effective, if at all. Plus, if you're taking multiple medications to manage post-concussion symptoms, that puts extra strain on your liver. Sadly, they are also the main solution many doctors turn to for PCS patients. Adolescents face unique challenges with medications because they can have more serious side effects, such as suicidal feelings while using antidepressants. We don't know the long-term effect of these medications on the developing brain. Anything you can do to relieve or minimize symptoms without medication is usually better for your overall health. For further reading, see medication for post-concussion syndrome symptoms. Natural remedies for post-concussion syndrome. There are a few natural remedies we have seen our patients taking that you may find helpful as well. B12, also known as folate, is thought to help with mental fatigue and irritability because it can be quickly broken down and provide the body with energy. This is why drinks like 5-Hour Energy contain B12 along with other B vitamins. But a recent systematic review and meta-analysis found that there was no correlation between B12 and cognitive improvements in patients without advanced neurological disorders. Curcumin is the key active ingredient in turmeric. Curcumin, when combined with black pepper, has been shown to have antioxidant and anti-inflammatory effects. Magnesium plays a role in the transportation of calcium and potassium ions across cell membranes, a process that is important in nerve impulse conduction and normal heart rhythm. Some patients find that intravenous magnesium provides headache relief. Melatonin is a hormone found naturally in the body. Some take melatonin to adjust the body's internal clock. It is most commonly used for improving sleep quality or overcoming insomnia. Do not start or stop taking supplements without consulting your doctor. We have another post that takes a comprehensive look at natural remedies for post-concussion syndrome, including approaches like acupuncture, physical activity, diet, tea, and more. Top doctors for post-concussion syndrome. We understand that you may not be able to travel to our office in Provo, Utah for post-concussion syndrome therapy. Instead, you may want to see what your options are for clinics in your local area. Because we want to help you make an informed decision about your health care options, we have created a blog explaining how to find the best concussion clinics in the United States. The blog post answers questions such as, do I need to go to a concussion clinic? What types of services does a clinic offer? And how can you tell if a concussion clinic is good or not? Oh, further reading, how to find the best concussion clinic near you. There are many types of doctors you could visit for post-concussion medical care, including family physician, pediatrician, sports medicine practitioners, emergency department doctors, neurologists, neuroradiologists, neuropsychologists, physical medicine and rehabilitation physicians, physiatrists, endocrinologists, and more. Further reading, types of head injury doctors. Keep in mind that not all healthcare providers are capable of treating PCS well. A primary care or pediatric doctor can only offer basic medical attention. They might not be able to diagnose your concussion and make referrals. Many people ask us about neurologists. A degree in neurology does not necessarily mean that you have expertise in post-concussion syndrome. In fact, according to this survey, many neurologists don't know that there are effective treatments for post-concussion syndrome. A neurologist can provide you with medication and may or may not have a system in place to connect you with specialists in neuropsychology, physical therapy, and cognitive therapy. For further reading, what a neurologist can and can't do for post-concussion syndrome. Sports medicine doctors. They can have a good program in place, but their education may not have been geared toward treating PCS. Make sure the doctor you're seeing has expertise in rehabilitating persistent post-concussion syndrome, even if you're seeing them after a sports-related concussion. Some patients visit functional neurologists in the hopes that it will alleviate their symptoms. Can they help you? It's a complicated answer. You can read more about what functional neurologists can and can't do for post-concussion syndrome in this link. Do your research and don't be afraid to ask questions or find a new doctor if the one you're seeing isn't getting results. If you haven't yet had testing for hormone imbalances, you can ask your primary care doctor, OBGYN, or endocrinologist to run some tests based on your symptoms. For more information, including questions to ask your doctor, read our article, How to Talk to Your Doctor About Hormone Imbalance. Persistent post-concussion syndrome. What if your symptoms haven't responded to treatment? Sometimes clinicians and researchers use the phrase persistent post-concussion syndrome to describe what patients experience when their post-concussion symptoms aren't going away. But since most post-concussion syndrome cases don't go away without treatment, we treat the terms as synonymous. That being said, we've spoken with plenty of patients who are frustrated because they didn't get better after treatment by other doctors or at other clinics. In that sense, their PCS really is persistent. Symptoms remained even after treatment. One of our patients, Sam Pembleton, tried all of the concussion clinics she could get to in Ontario with no luck. She even flew to a clinic in Boston and they sent her home because she wasn't responding to treatment. She suffered through 5 years of persistent PCS before she came to Cognitive FX. After treatment at our clinic, she was able to work and finish school, go out with friends, and simply enjoy life again. One of our other patients, Mirta Van Boon, was told by her doctors that she would never recover after a skiing injury. After treatment, her quality of life improved rapidly. She felt like she could finally be present in her daughter's lives the way she dreamed. So how can you go through treatment at multiple facilities and still not recover from PCS? As it turns out, most cases of PCS are treatable, but not all patients respond well to one specific treatment protocol. PCS is not a one-size-fits-all. The brain regions affected by your brain injury are likely not the same as regions that were damaged in someone else. But most treatment programs don't take these differences into account, in part because they often don't have the ability to determine precisely how and where the patient experienced neurotrauma. Making matters worse, not all doctors have the same familiarity with traumatic brain injuries and how to best treat them. As a result, some patients are only given medication or maybe some occupational therapy to help them adjust to life with symptoms. Others are given therapies, some of which can be truly excellent, but not at the right pace or intensity for neuroplasticity to kick in. Others may provide perfectly good regimens that simply aren't tailored enough for the needs of the patient. That's why providing each patient with an FNCI scan is so important to our work. It tells us which brain regions were affected and in what what way, which in turn lets us know exactly what kind of treatment to provide, and that's why patients like Sam and Myrta, who've tried many different doctors, were able to make progress under our care, but not elsewhere. If you're experiencing symptoms that won't resolve after one or more concussion, you're not alone, and you're not crazy. On average, our patients improve by 75% after treatment at our centers specialized in PCS. To see if you're eligible for treatment, schedule a consultation. How long does post-concussion syndrome recovery take? Many studies have found that PCS recovery time varies drastically. Some patients recover after a couple of weeks without any long-term side effects. Others struggle with symptoms for the rest of their lives. Some studies even go as far as to state that PCS may be permanent if recovery has not occurred by 3 years. A recent study found that only 27% of PCS patients meet diagnostic criteria at 3 months post-injury made a full recovery. The article, Early Clinical Predictors of 5-Year Outcome After Concussive Blast Traumatic Injury, states that many concussion patients experience the evolution of symptoms 5 years after mild TBI, not the resolution of symptoms. 72% of patients had worsening symptoms after 5 years. Their findings indicate that concussion symptom prevalence is likely to increase over time rather than resolve. This can leave PCS sufferers with little or no hope for recovery. What we found is that it doesn't matter how old your injury was, the key to recovery is getting the right treatment. On average, our patients report a 60% improvement in their symptoms in 1 week. We also performed follow-up research using FNCI scans on 28 previous EPIC patients, approximately 1 year post-treatment. The average amount of time between the completion of EPIC and the follow-up FNCI was 329 days. We found that patients' scores on average continue to improve, indicating that EPIC treatment makes permanent changes in the brain to regulate neurovascular coupling and restore healthy brain function. For further reading, Recovering from Post-Concussion Syndrome and How to Tell the Difference Between Post-Concussion Syndrome, Chronic Traumatic Encephalopathy, CT, and Sudden Impact Syndrome, or SIS. Patient recovery stories. It's one thing to learn about the neuroscience behind EPIC treatment, the program we offer, but we understand that it's important to hear about real recovery stories too. In addition to film testimonials, we have posts about several patients who wanted to share their recovery stories, and we'll keep adding more stories to our blog, but in the meantime, you can catch up on these stories. One of our patients, Olivia, was a figure skater who suffered from PCS for years without knowing what it was. Once she learned about PCS, she visited our clinic for treatment and then wrote about her many symptoms, her FNCI scan, and her experience with therapy at Cognitive FX. Kieran Williamson suffered a concussion in a bike accident. In the days that followed, she couldn't even speak comprehensibly. Instead, she babbled, unable to express her distress. As her words slowly came back, other symptoms like sensory sensitivity got worse and worse until all she could do was hide in a dark room. Now that her PCS is treated, Kieran is able to ski, work, play with her family, read about this incredible concussion recovery journey. We also had the opportunity to interview Sam Gray, who didn't experience a concussion, making him unlike most patients we see. When Sam was 11 years old, a blood vessel in his brain broke. For 33 years, Sam had been living with symptoms from the brain trauma. Sam discovered Cognitive FX from his older sister who had taken her son in for treatment after a skiing accident. Learn more about Sam's amazing TBI recovery journey and how he's doing now as an EPIC graduate. Anthony LeBay worried that he'd never practice law again when he sustained a concussion in a car accident. What he thought would be a quick 2-week recovery turned into months of terrible emotional symptoms, brain fog, short-term memory loss, difficulty reading, and more. Post-treatment, he's been able to return to legal practice and enjoy activities once again. There is hope for your recovery. If you're experiencing PCS that you have not resolved on and is not resolved on its own, you are not alone. Other patients have gone before you and found real relief from their suffering. We won't promise you a miraculous 1-week recovery that fully restores your pre-injury self, but we can give you a fighting chance. Most of our patients go on to live the lives they've left behind after their concussions. With perseverance, hard work, and good medical treatment, they're able to overcome the brain damage they suffered. On average, we help our patients improve by 75% in brain function after completing EPIC treatment at our clinic. Our patients self-report an average improvement of 62% on their post-concussion symptoms, and most continue to improve after going home. Want to know if EPIC treatment is right for you? Schedule a consultation. We'd be happy to discuss what options are available helpful to you as a PCS patient.